Hi, I'm Dr. Michael Vanella with Vanella Chiropractic. After practicing for over 22 years and helping thousands of people regain their lost health, I've learned a few things. I have practice members that consistently get the best results possible in the shortest period of time and for the least amount of money. I figured out that these practice members actually know something that most people don't. So I'd like to share with you exactly what it is that they know, what we do, why we do it, and how we can impact your quality of life. Now, there are two types of patients that come into my office. You have the type of patient that has some type of discomfort or pain, and they want it to go away, but that's all they want. So after I get rid of their pain, when do I see that patient again? Well, rarely, or the pain never returns. The second type of patient that comes in is not only interested in getting rid of the pain, but they're actually looking more towards getting healthier 5 years from now compared to what they are today. Most of the patients that come in our office aren't healthier today than they were 5 years ago, but they do want to be healthier 5 years from now than they are today. Well, these are the patients that my office caters to. We want to get rid of your discomfort. We also want you to be healthier 5 years from now than you are today. So the first thing I ask patients when they come in, because they are seeing a chiropractor, is what's the first thing that comes into your mind when you hear the word chiropractic? They will say the adjustment, which happens to be to the back, which includes bones of the spine. And that's the kind of what most people think. They believe that chiropractic is all about bones. But really, we're not bone doctors at all. We really don't have anything to do with the bones. We're actually nervous system doctors. What we're interested in is what the bones are protecting, which is your brain and spinal cord. Both of which make up your central nervous system. Off of that comes all the nerves that control everything else. If we take a look at the nervous system and we were to bisect the nerve in half, we can literally see 3 different departments of the nervous system. The blue part is the motor part of the nervous system, which controls the muscles. If we see stress or interference on that part of the nerve, we can have everything from weakness, tightness, spasm, to fatigue. The yellow part of the nerve is the autonomic part of the nervous system. This controls blood vessels, glands, and organs. If we see stress or interference here, you could have sinus and allergy problems, stomach troubles, low energy, breathing problems, just for some examples. And the red part is what brings people in. That's the sensory nervous part. And that does one thing only, and that's perceive pain. So if you can see how the nervous system is set up, 10% perceives pain, 90% is use of function. So that means that you can have excruciating pain and literally be functioning fine. And you could have no pain at all and not be functioning well at all. So let me ask you a couple of questions. If I put my hand on a hot stove, is it going to hurt? Of course it will. But does it tell me that I have cancer, diabetes, or heart disease? No. Now, if I have no pain in my body, does that tell me that I don't have cancer or heart disease or diabetes? No either. So literally, we have to look at the nervous system as based more on function than it is on feeling. Now, what's really kind of upsetting to some of us chiropractors is that many chiropractors, as many as probably 9 out of 10 practices here, the sensory part of the nervous system, which is the pain part. So you're probably getting an idea what area of the nervous system I concentrate more on. I focus more on the 90% than the 10%. But does that mean that I forget about the 10? No. Because the 10% actually makes up the 100% along with the other 90%. So as a chiropractor, I want to pay attention to the nervous system 100% of it. Not 10% of it, and not just 90%, but all 100% of the nervous system. So let me tell you how the nervous system works and really what its job is to do. The job of the